Hello guys, my name is Anleep Sheikh and I'm going to talk about Mrsa. Mrsa stands for methicillin-resistant Staphylococcus aureus. Mrsa can spread in hospital amongst athletes, daycare, and school students, and those who receive inpatient medical care or have surgery or medical devices inserted in their body are at a high risk of Mrsa infection. Most infections are usually associated with invasive procedures or intravenous tubing or artificial joints. What is the infectious agent and risk factors? Staphylococcus aureus is a type of bacteria found on people's skin. Bacteria are usually harmless, but they can cause serious infections that can lead to sepsis or death. Non-intact skin, such abrasions or incisions are the risk factors of MRSA. The incubation period of MRSA is 4 to 10 days, and the contagious period is as long as the bacteria is in nose, throat, and mouth secretion. Symptoms usually start as swollen, painful red bumps that may look like pimples or spider bites. The affected area may be warm to touch, full of pus or other drainage with a high fever. Where should the testing be done? A nurse or a medical assistant will run a blood swab over the affected area so that it can be checked for MRSA. Swabs may be taken from several places such as nose, throat, armpit, groins, or any damaged skin. The sample is then sent to the lab where it's placed in a dish of nutrients that encourage bacterial growth. Most tests take 24 to 48 hours to get results back, but a new test called Cobus Vivo DX can deliver results much faster. Importance to clinical staff and community. In healthcare facilities such as hospitals, nursing homes, MRSA can cause severe problems including bloodstream infections, pneumonia, surgical site infections. In the community where we live, MRSA most often causes skin infection. In some cases, it causes pneumonia. It's a lung infection and other infections. If left untreated, MRSA infection can become severe and cause sepsis, the body's extreme response to an infection. Transmission and precaution and prevention. MRSA is usually spread in the community by contact with infected people or things that are carrying the bacteria. This includes through contact with a contaminated wound or by sharing personal items such as towels, razors that have touched infected skin. Prevention and precautions. Maintain good hand and body hygiene, which includes washing hands is the number one way to stop spread of infection. Keep cuts, scrapes, and wounds clean and covered until healed. Avoid sharing personal items such as towels, razors. Do not pick or pop the sore. Get care early if you think you might have an infection. Sterilization. Hospital rooms are cleaned with detergent-based cleaners or Environmental Protection Agency EPA registered detergent. Disinfectants which remove MRSA from surfaces in the healthcare setting. The standard approach for room cleaning involves the use of a quaternary ammonium disinfectant or quat. Most hospitals use three methods for killing the germs: irradiating the room with ultraviolet after using a quad, replacing the quad with bleach and replacing the quad with bleach and irradiating the room with ultraviolet light. Conclusion. The other consideration a person should avoid taking a lot of antibiotics without a prescription. This can increase the chances of getting MRSA since it's a staph infection resistant to many antibiotics. If possible, patients with MRSA should have a single room or can share a room with other MRSA patients. Healthcare providers should wear PPE, personal protective equipment, while taking care of MRSA patients to avoid contamination and spread of infection. Thank you guys for watching my PowerPoint. I appreciate it. Thanks again.